I'm going to be doing my bone video on the axial skeleton, and here's the skeleton here for demonstration. I'm going to be starting with the cranial bones. I'm going to start with the frontal bone, which is here. Then I'm going to go to the parietal, it's here. Next is the occipital. Occipital is here. Okay, then we have the external occipital protuberance. What is this for? It is for keeping the head upright and allows the head to tilt backwards. And that you will find right here. Kind of the bump right there. And then temporal, which is here. Now the external view. So I'll put him on the side. This is the external view. And you will see the temporal mandibular joint. So here's the mandible, here's the temporal. So the temporal mandibular joint would be right here. Okay, next we have the mastoid process. The mastoid process is right here. And then the styloid process, which is in there, right there. Okay. Next we have the external acoustic meatus, and that is right there. Okay, next we have the squamous part. The squamous part is right here. Okay, next the internal view. So for the internal view, I'm going to be opening his head here. And then looking at it this way. And then the petrous part is going to be right here. The petrous part is going to be right here. And then see what structures are housed within this part, and it is the styloid process and the mastoid process. Next we have the internal acoustic meatus, and what passes through this opening? Well, it is a narrow passageway where the vestibular nerves and the cochlear nerves pass through, and you'll find this right here. Right here. Okay, now we're going on to the sphenoid. Okay, and the external view, lateral and orbital parts, greater wing. So the greater wing is here, and the lesser wing is here. Okay, and next is the superior orbital fissure, and what passes through, nerves pass through, and it is right here. Okay, next we're going to do the internal view. So as you can see right here, and this is the sphenoid right here. Okay, and then we're going to do the lesser wing. The lesser wing is right here. Okay, and then the greater wing is right here. Okay, and the optic canal, what passes through? The optic nerves and ophthalmic arteries. Okay, the optic canal is right here. That's the optic canal. Next is the sella turcica, and that sits, the pituitary gland sits there, and it's right here. This area right here. Okay, now we're going to the ethmoid and the internal view, the crista galla. The crista galla is going to be right here. Okay, and then what does this do? It secretes dura mater to the bone. Okay, and then the cribriform plate, what passes through these points, and the filaments of the olfactory nerves pass through, and the cribifactor is right here. Right here. Okay. Okay, now I'm going over the sutures. So we're starting out with the coronal, The two bones are the frontal and the parietal. So it is going to be right here, the suture right here. Okay, and this is the frontal and the parietal. Okay, and then next is the sagittal, and the two bones are the two parietal bones. And that is right here, the two parietal bones. Okay, and then next is the lambdoid, which is the occipital and the parietal. So right here, the bones are the occipital and the parietal. Okay, next is the squamous, which is here, and the temporal and the parietal right here. Okay, now we're going to the facial bones. We're going to go with the maxilla and alveolar process. Maxilla is here, and the alveolar process is here. Next is nasal, and then zygomatic. Zygomatic is the cheekbones right here. What two bones form the zygomatic arch? And that's the temporal bones posteriorly and the frontal superiorly. Okay, and then the ethmoid. The ethmoid is here. And then the vomer right here, in between the nose, right there. And what two bones form the nasal septum? And that is the perpendicular plate and the vomer. Okay, next is the inferior nasal concha. What does this bone do? It helps to swirl and filter air entering the nasal cavity, trapping particles in mucus before air gets in the lungs. Okay, so you're gonna find that right here inside the nose, right there. Okay, mandible, that's the jaw right here. Okay, and then the body is this part right here, and then the angle is right here, and then the ramus right here. And then the mandibular condyle is here. And then the mandibular notch right here. Right here. Then the coronoid process right here. Okay, now we're going to do the vertebral column. And we're going to start with the curvatures. There are 4 curvatures. This is the cervical curvature. And then the thoracic curvature. And then the lumbar curvature, and then the sacral curvature right here. Okay, now we're going to start with the cervical vertebrae. There are 7. They're right here. And then the atlas, which is here. What does the bone articulate with superiorly? The occipital condyles, and it allows you to go like this, and like you're nodding yes. And then next is the transverse process, which are this right here. And what is unique about the transverse process, and what is unique about them is that they have holes in them. The vertebral arteries come up from the neck through these holes before entering the base of the skull to supply blood to part of the brain. Okay, now I'm going on to the thoracic vertebrae, and there are 12. Okay, they're here. This is the thoracic vertebrae, and then the spinous process are these right here, pointing out. And then the transverse process is here. And then the intervertebral foramen is inside, so the whole inside here. Inside there, the hole there. And what passes through these foramina is the spinal nerves. Then the body or centrum is here. Okay, and then the position of the intervertebral discs are in between, so they're in between each vertebrae. And then The next we're going to do the lumbar vertebrae, and there's 5. And this is the sacrum here. And how many vertebrae fuse to form this bone? And there's 5. And the coccyx is here. Okay, now we're going to do the sternum. The sternum is here. The manubrium is here. The body is here. The xiphoid process is here. And the jugular notch is here. Okay, next we're going on to the ribs. The ribs are here. The vertebral sternal, which are the true ribs, are right here. Ribs 1 through 7 right here. And then the false ribs, which are the vertebrochondral ribs, are here. Number 8 through 12 right here. Okay, and then the floating ribs are these 2. These right here that seem to be floating. Okay, and now we're going to point out the head, neck, and tubercle. So the head is right here on top. Okay, and then the neck is right here, and then the tubercle is right here. Okay, and let's explain how the ribs articulate with the vertebrae. The first rib articulates with the first thoracic vertebrae, the head articulates with the demifosset, and the tubercle articulates with the costal fossa.